that we can utilize, and how do we really manage diseases from a public health perspective. As mentioned, in this topic, there are a couple things I want to touch upon. Number one, figuring out and defining what is public health. We'll go into the definition. We'll learn about the different aspects and the 5 fields within public health. Then we'll jump really into epidemiology, which is how we study and control diseases. We'll touch upon the importance and the use of data in healthcare. And then lastly, I want to touch upon some key points about what effects COVID-19 has had on heart patients. So what is public health? Public health can be defined as the science and the art of preventing disease, prolonging life, promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. And when you look at this definition, it encompasses pretty much everybody. We've got private individuals, we've got communities, we've got organizations. All of these entities are coming together and essentially coming together to promote health with the ultimate goal of prolonging life. And it's not just prolonging the amount of years that an individual is living, but it's actually promoting healthy life, that we increase our life expectancy in a healthy manner, that we want people to live longer, live healthier lives. It's a multidisciplinary field whose goal is, again, to promote the health of an entire population. We're focused on preventative measures rather than the actual treatment of a disease itself. And we're really focused on the greater population and not specifically on individuals. And that's what separates public health from clinical medicine, which is focused on the treatment of each patient one by one. And that's actually one of the reasons I came into public health, because I felt that as a physician, you are treating one patient by one patient, and you're seeing similar types of patients over and over again. And public health gives me the opportunity to treat the entire population and to really find preventative measures. When we think about prevention itself, the textbook definition of prevention is the act of stopping something from occurring. And in the public health context, it's really aimed at reducing the development and the severity of diseases and other health conditions. And within public health, we have 3 main types of prevention. We have primary prevention, which is intervening before health effects occur. So stopping a disease from ever occurring. This is done through measures such as vaccinations, decreasing risky behaviors such as poor eating habits or smoking or tobacco use. Then we have secondary prevention, which is focusing on screening to identify a disease in its earlier stages before the major onset of signs and symptoms occur. And this is essentially so that we can catch a disease before it's going to occur. A good measure, an example of this is taking blood pressure on a regular basis, going for certain screenings of tests and health conditions. And then we have tertiary prevention. This is managing a disease post-diagnosis. So once an individual has been diagnosed with a disease, tertiary prevention comes in, and this is essentially to stop or to slow the progression of the disease. It's done through measures such as chemotherapy and rehabilitation, and then taking the appropriate medications for a disease. There are many determinants of public health. And going back to that definition, that it encompasses pretty much all of society, the determinants of public health are very similar. They begin with innate individual characteristics, such as one's age, their gender, their race, ethnicity, as well as genetic predispositions. It then moves into individual behaviors, whether those are healthy behaviors such as eating right, exercising on a regular basis, not smoking, not drinking, etc. We then move into the next circle of social, family, and community networks. These play a huge role in terms of the general health of an individual. Research has shown that individuals who are well connected with their family members, with their society, have healthier outcomes. One's living and working conditions also play an important role. If one is living and working in good conditions, healthy conditions, that's going to affect their overall mental state and their health. And then there's broad social, economic, culture, and health contexts as well. Within public health, we know that there's certain social determinants of health, that a person's social status as well as their economic status plays a role in the access to healthcare that they will have, which ultimately plays a role in their own health. And so within public health itself, there are 5 main disciplines. In each of these disciplines crosses over into one another, and they're all intertwined with one another. These 5 disciplines include health policy management, so understanding how to create policies, the importance of policies, the importance of maintaining policies, and how they will affect an individual's health. The second discipline in public health is health behavior and health promotion. This is focused on what are healthy behaviors of an individual, what are risky behaviors of an individual that may affect their health. How do we incentivize individuals to decrease their risky behaviors and increase their healthy behaviors? How do we promote health education in the broader community? The third discipline is environmental health. How does the environment affect an individual's health, their mental state? How does all of that play a role in society's health? Things related to environmental health could be sanitation, could be related to pollution. And then we move into epidemiology, which is going to be the focus of this presentation today, which is really trying to figure out where and why and how a disease is occurring. And then all of these disciplines are tied by biostatistics, which is the application of statistics and math through these disciplines to really understand what is making an impact and what is significant from a statistical standpoint of view. Also within both epidemiology and biostatistics, we focus a lot on trial design and being able to find out what's occurring in a population from a health perspective. And so some public health activities that are very common to the field include preventing epidemics and the spread of diseases, protecting the environment against hazards, preventing injuries, such as seatbelt safety laws, or wearing a helmet when you're riding your bicycle. Also, public health activities include promoting and encouraging, again, those healthy behaviors, not using tobacco, eating healthy, exercising on a regular basis. And another key component or activity within public health is understanding the history and trends of a disease. Knowing what has occurred in the past, knowing what is going to be occurring, potentially what can occur in the future. Are diseases cyclic in nature? Do they occur every other year? Do they occur every season? And then another key component of public health activities include assuring the quality and the accessibility of health services. Who has the access to healthcare? Are the services adequate to take care of the entire population? And public health has 3 core main functions. And within those core main functions, we have certain essential health services. The 3 main core functions are assessment, policy development, and assurance. The essential services include monitoring the health, So understanding what is occurring in a community, monitoring the health, doing surveillance to see how many individuals are having a condition or a certain disease. The second aspect is diagnosing and investigating. That includes trying to figure out why a disease is occurring, where it's occurring, is it occurring in a certain population? The third aspect is informing, educating, and empowering, that we inform individuals where a disease is occurring, why a disease is occurring. We educate them in terms of what are healthy behaviors and risk factors. We mobilize community partnerships. We then develop policies, taking in consideration the amount of education that has been given, taking in consideration the resources that are available. Once those policies are developed, we enforce the laws. We link it to providing care, making sure that the adequate health services are there. We need to ensure that we have a competent workforce, that within the public health workforce, individuals know how to treat diseases, they know how to monitor, they know how to develop policies and get them implemented. And then lastly, we evaluate. We evaluate whether or not all of this has been working. And if it's not working, then we go back, and as a cycle, we go back and we again monitor the health, we again diagnose and investigate, and it continues and continues. And so when we think about the actual public health system, these are just a few of the entities that work in the public health system. And if you look at this slide, you'll realize that it is a very complex and very busy slide. There are individuals in hospitals who are working in public health. There are elected officials. There are schools. There are health departments, the police, the fire departments, laboratory facilities, mental health facilities, individuals who are focused, individuals, communities, and entities that are focused on economic development. All of these together are the public health system. And as you see the links between them, they are all intertwined and linked to one another. And so when we think about job classifications within the public health arena, there are many, many job classifications. We have behavioral health professionals, we have emergency preparedness staff, we have epidemiologists, we have health educators, laboratory workers, we have public health physicians, public health nurses, IT individuals, and we have many, many other public health professionals. And so the career path to public health is very, very wide, very broad. Many, many careers touch upon public health, and there are many, many career paths. Specifically, you can go into medicine and then go into public health. You can go directly into public health doing a bachelor's degree in public health or a master's or a PhD. There are many individuals who are in the IT profession and then dive into public health data and making that accessible and accessible to entities and hospitals and government work in the government workforce. So there are many, many career paths into public health. And one of the things I want to mention about public health career paths, all of them will intersect with epidemiology, because epidemiology really is the central core to public health. When we think about public health being that art and science of prolonging life, what are the things that decrease life? They are illnesses, chronic conditions, things of that nature. And epidemiology is focused on figuring out and finding out where those diseases are occurring, why those diseases are occurring, and coming up with hypotheses and evidence-based treatments and evidence-based guidance to how do we prevent those diseases and those chronic conditions from occurring. And so what is epidemiology? The field itself is based on two fundamental principles. Number one, that human disease does not occur at random, that there are factors or determinants which increase or decrease the likelihood of disease. And number two, that those factors or those determinants, some are causal in nature, some are preventative, that those factors and determinants can be identified. And how are they identified? By systematic investigations of populations or subgroups within populations. So epidemiology is focused on the factors and the determinants of a disease. And so specifically, its definition, it is the field, the study of the distribution and determinants of disease frequency in human populations, in the application of this study to control health problems. And this definition is loaded. It's loaded with keywords. The first keyword is distribution. How is the disease distributed throughout the population? Is it distributed in a certain type of people? Does that mean by age? That individuals older than 65 are more prone or susceptible to a disease? Or maybe it's that individuals less than 18 or youths are more susceptible to a disease. Perhaps gender or sex, that men or women are more susceptible to a certain disease. Or race or ethnicity, socioeconomic status as well. Distribution also looks at the place. Is it urban? So is it within the cities or is it rural? Is it geographically specific to a certain state or country or continent? Is it near some type of environmental hazard like a incinerator or a landfill? Is the disease distributed in a season? So for example, the flu season, we know that flu usually occurs between October and March every year. So we're focused on understanding that distribution in terms of time. The second key word in the definition is determinants. These are factors that cause some people to get a disease, factors that prevent some people from getting a disease. We also term these as being exposures. So we know that individuals who smoke have a higher chance and likelihood of getting lung cancer. And so in that case, the exposure is smoking. We know that individuals who have diets high in cholesterol and fat with a lack of exercise are more prone to diabetes or more prone to heart disease. So in that sense, diet and exercise are also exposures. Disease frequency is another term within this definition. And that basically means that as epidemiologists, we are counting the number of cases of a disease in a certain population in a specified time. So we are actually physically counting the number of cases in a population, new cases as well as total cases. Another key word is human populations, that we have different groups of individuals within our population. And a population is defined as a group of people with a common characteristic, such as perhaps living in a certain place. Maybe it's a neighborhood, maybe it's a city or a state. Again, it could be individuals who are aged or with the same gender, or maybe it's somebody in a group. A group could be all of the individuals who are partaking in this presentation, in this webinar. Or a group could be based on a historical context, individuals who fought in a certain war, or individuals who were present during a certain activity. Those are all based on a population. And then the last part of the definition is also very, very important. And that is that the application of this study, of finding out the distribution, the determinants and the disease frequency in a population, that all of this is really for a purpose. right? That there's no point in collecting and analyzing data if it cannot be used to help and control the problems. And so the last and major part of epidemiology is applying what we learn in terms of the numbers of a disease, in terms of the risk factor of the disease, applying all of that knowledge to basically control health problems in our society, in our population. Within epidemiology, there are many subdisciplines. You can have cancer epidemiologists, you can have cardiovascular epidemiologists, infectious disease epidemiologists, genetic epidemiologists, social epidemiologists, pediatric epidemiologists, and the list goes on and on and on. And epidemiology helps us to answer the questions, you know, is the rate of traffic accidents increasing in a certain location? Why are they increasing? Why are they decreasing? What was the cause of the hepatitis outbreak? Who is most likely to get COVID-19? Is ginger tea effective in treating the common cold? Do soft drinks increase the risk of diabetes? And so you can think of many different questions that would pop up related to one's health. All of these questions can be answered, or at least can be investigated through epidemiology and epidemiological methods. Within our investigations in epidemiology, there is a certain sequence of events. You know, the first thing that occurs is we suspect that a certain exposure influences the occurrence of a disease. So again, thinking of lung cancer and smoking and lung cancer, we may see in society that a lot of people who are smoking are getting lung cancer or have lung issues. From there, we will form a specific hypothesis related to that exposure and that disease association. We'll actually conduct an experiment, a study to measure the relationship between that exposure and that disease. Once we conduct that experiment or that study, we'll look at our data and we'll ascertain whether or not there really is an association. Is that association large, small? Is it valid? And then we'll evaluate that association and implement policies, treatments, guidelines. And really our goal in terms of the design and the decisions in epidemiological research is really to understand that exposure and what is the relationship between an exposure and an outcome. When we think about the types of epidemiological studies, there are dozens and dozens of different types of studies that epidemiologists can apply. We basically often classify them in this manner of experimental versus non-experimental. Experimental studies are we as investigators, as researchers, as public health individuals are intervening and doing an interventional study. That interventional study may be randomized or not randomized. The gold standard in epidemiological research is the randomized clinical trial, where we are putting individuals on a random basis in two groups, testing out a new methodology, a new treatment. We also have a lot of non-experimental or observation studies. These can be population-based, where we're looking at the entire population, or they can be individual-based, where we're focused on the health aspects of an individual to guide us and to explain what are the collective risk factors involved in a population. When we think of individual-based studies, we can be both descriptive, where we're just describing certain happenings in a population, or we can be more analytical. Analytical studies are, in epidemiology, the main types are cross-sectional studies, case control studies, and cohort studies. When we think about these studies, for example, in an experimental study, we take a source population, We have our treatment groups, and then we follow them over time to compare the incidence of an outcome, to compare what is occurring in terms of that health risk or that disease. When we look at cohort studies, again, very similar in nature, that we have our source population, we divide them in two groups. Cohort studies are more observational in nature, so we are not intervening, we are just observing these two groups. These two groups are, one group has that exposure, the other group doesn't. We follow them over time to understand within each group what was the incidence or the number of new cases of the outcome that we're focused on. Case control studies set up in a very similar manner, where we take individuals within our source population, individuals who have the disease that we're focused on, individuals who don't have the disease, and then we examine those individuals based on who was exposed and who wasn't exposed. And so a key component of epidemiological studies is data. Data is fundamental to targeting and implementing evidence-based control measures to protect the public health and their safety. Within epidemiology and public health, we are focused on finding reliable, valid data. We want to make sure that the data that we have is the most relevant data for meaningful purpose and getting the meaningful results that we want. Oftentimes, we will combine data sources. Oftentimes, the data sources that we find may not be standardized, they may not be interoperable. And so a lot of work is done in terms of finding data. If we are collecting data on our own in our own studies, a lot of work is done to ensure that the definitions that we're looking for are correct. A lot of work is done to ensure that we're not interjecting bias or systematic errors into our data collection methods, that we're standardizing our data collection methods. The data collection method itself is very important. Where do we store it? How do we store it? How do we access the data? All of those things are very important. How are we going to analyze the data? If the data is coming from those different sources, is some of the data from electronic sources? If it's from electronic sources, how do we extract out that data? So that's where IT individuals come into play and are fundamental to understanding and leveraging healthcare data. Again, the combination of data from various sources. We also have to make sure that those sources are reliable, are valid, they are covering the same patient population that we're focused on, and that there aren't any differences in those different data sources. So where are our data sources coming from? Pretty much all over. If you think about all of those entities who are involved in the public health system, all of those entities are supplying data. That includes governments. So it could be local governments, it could be state governments, federal, it could be international, NGOs, so non-for-profit organizations and non-governmental organizations like the Heart Association. We collect patient data on a regular basis through partnerships with hospitals, through partnerships with government entities. HMOs and insurers and healthcare payers, they are gathering data on the healthcare services that their employees and individuals who are paying for insurance through them. All of that data is being collected in terms of where you're going, where you're going to be seen, who is seeing you, and what tests are being done, and the results of those tests. Hospitals are a huge source of data. Hospital systems collect data on all of their inpatient as well as outpatient data, and independent researchers. Those researchers could be in industry like pharmaceutical companies. Those researchers could be at academic centers, at universities. who are going out and either collecting data on their own or again partnering with some of the above entities that I've mentioned. What are they collecting? They're collecting all sorts of data. The government may be collecting census data, vital statistics, lab data, again, hospital discharge data, etc. What are some of the major sources of data? The census. The census is complete count of an entire population. Here in the United States, we do our census every 10 years, where we enumerate and count every individual in the country. Vital statistics. So every city, every state is collecting data on births, deaths, marriage, divorce, and fetal deaths. That is all being put into a central database. Also includes information related to birth weight and information related to the cause of somebody's death. There are national health surveys where data is gathered on major health problems, including injuries and chronic illnesses across the United States. There are national health and nutrition examination surveys where information related to individuals' diets and their overall health is gathered. There are major descriptive public health data sets related to behavioral risks. How many people are smoking, how many cigarettes per day are they using, alcohol use, physical activities, do individuals wear seatbelts, etc. Immunization. We have a large database related to immunizations. We have databases related to drug use. And then we have a lot of databases related to just surveillance of infectious diseases. So the CDC requires that states send them on a weekly basis the number of cases of certain infectious diseases like chickenpox or HIV or the flu, and nowadays specifically COVID-19. And so some of the considerations that we need to take when we're looking at data and interpreting data, we need to know the specific population that is covered by the data collection system. We need to understand the time period that it is collected. We need to understand that every system is going to have limitations. Data is always going to be incomplete. And oftentimes we're going to find inaccurate material and inaccurate data. And so we have to come up with alternative scenarios and alternative methods to handle that type of data. And so we also have to pay attention to what the data is actually telling us. Is the occurrence of cases of a disease, is that what we would expect? Or is that in excess of what we would expect? Is that excess localized, or is it spread? In this graph, I've mentioned three big terms in epidemiology and public health: endemic, an outbreak or epidemic, and a pandemic. An endemic is just the usual occurrence of a disease in a certain area. And so in the winter, the cold is endemic. It's very common that people will get a cold throughout the winter season. It usually lasts a week, and then it moves on. An outbreak is where we have an excessive amount of cases of a certain disease. And so it could be related to food poisoning. 40 people went to a party, they all had the potato salad. The potato salad had some type of bacteria. Everybody ended up getting sick. That's an outbreak, of gastrointestinal outbreak in that area. An epidemic could be COVID-19. COVID-19 started as a localized epidemic within a certain geographical area, and then it spread across borders, across countries, across a continent. And once it spread worldwide, it moved from being an epidemic to a pandemic. And also related to interpreting results, having the data is not enough. It's really about how you critically look at that data. So for example, oftentimes in the media, we'll see a headline that says successful completion of this treatment will cut your risk in half. And that sounds great. But really it depends on what is the risk, what is cutting the risk in half. If your risk of a certain disease or certain illness is 80% and the treatment cuts it in half to 40%, well, that's wonderful. That's earth-shattering. But what if the risk is 2 and it reduces it to just 1? And so context really, really matters when we think about interpreting results and understanding data. And so lastly, I want to kind of touch upon all the things that we've learned over the last 12 months, looking at data, looking at the epidemiological investigations related to COVID-19. What effects COVID-19 has had on heart patients? And it's important to understand first and foremost that COVID-19 is a novel disease. It's a novel virus. Up until 12 months ago, or 14 months ago, we really didn't know anything about COVID-19. It wasn't impacting society. And so what we've learned over the last 14 months has changed our perception of the virus, of the illness, and it continues to change. We are still learning a lot, and so some of the things that I've mentioned here on this slide may not be relevant in the coming months. But so far, what has the data told us? We've seen a strong connection between COVID-19 and heart inflammation. The inflammation of the heart is what we would call myocarditis. So we have seen an increased occurrence of myocarditis in individuals who have COVID-19. We've also seen that the sicker somebody is with COVID-19, the higher chances of developing myocarditis. We've also seen that people with heart conditions, underlying heart conditions like heart failure or having a stroke or perhaps atrial fibrillation or things of that nature, those individuals have a higher risk of developing severe COVID-19 and perhaps even dying from the disease. We've also realized that COVID-19 in fact impacts Blacks, indigenous, and people of color more. Part of this may have to do with the social determinants of public health and the social determinants of health, that individuals within these groups usually have a lack of access to health care and may have other underlying conditions that are leaning and pushing them towards a lack of a healthy life. And so really the jury is still out in terms of what effects COVID-19 has had on heart patients. There's a lot of research that is continuing to go on. Within the Heart Association, we have set up several disease-based registries, including one for COVID-19. There are many other disease registries and databases that are collecting data from a wide variety of sources. All of that data is being pulled together and being analyzed on a continuous basis. And so really, what has COVID-19 taught us? It's taught us the importance of preparedness. It's taught us the significance of health policy and the importance of having a sound infrastructure of not only just health in terms of hospitals, but also public health services. COVID-19 has taught us that data and understanding the science behind the data is very, very important and fundamental to understanding the trends of a disease and understanding the risk factors of the disease. COVID-19 has really opened our eyes and told us that we don't know everything. And that's part of being an epidemiologist. Epidemiologists are also known as disease detectives, that we investigate why a disease may be occurring, how it's occurring, where it's occurring. And so at the end of every epidemiological investigation, or at the end of every epidemiological disease that we investigate, we learn something new, and we realize that we don't know everything, and we possibly can't know everything. And I think one of the other important things that COVID-19 has taught us is really to expect the unexpected. We know that they are infectious diseases, but we don't know when they may occur, and we don't really know how widespread they could be. And so it goes back to that first bullet point that I mentioned, the importance of being prepared. If we all understand the impact of COVID-19 and the impact of infectious diseases or chronic diseases, like heart disease, like diabetes, on the overall health of an individual and a population, then we can spend our time understanding the risk factors and implementing healthier lifestyles and healthier choices in our life, so that we can prolong life and live a healthy life. And with that, I would like to thank everybody for their time today, and I will open it up to questions.
Yeah, so we'll start with the question in the chat first, and then anyone else can feel free to unmute themselves and ask. So the first question is, how important or useful is the data that is presented to us about the effectiveness of COVID vaccine? Should we be taking this data lightly or seriously, since there are several options with which vaccines we can take?
That's a great question. You know, and the COVID vaccination, the investigations and the studies in the COVID vaccinations, they were done very meticulously. A lot of things were done, a lot of things were taken in consideration. So the data that we're getting from these studies, and they were also done on a very mass scale. And so the data that we're getting from these studies are very, very important. And they're really telling us a lot of things. And I would say that no government, no entity is going to put out a vaccination that is not safe for individuals. And so a lot of scrutiny has been done on the data that we have, and the vaccinations that we have so far that we know are safe. And you know, epidemiology, public health is all about preventative measures. So it is important to look at that data, and it is important to get the vaccinations to help stop the spread of the pandemic.
All right, thank you. There's one participant who's raised their hand. Feel free to unmute yourself and ask your question.
I'm audible, sir?
Yes, go ahead.
Sir, my question is that, sir, what are the differences between public health and community health, sir?
Good question. Essentially, community health and public health are very similar in nature. Different terms for pretty much the same field. When we look at community health, we are also focused on the same disciplines: epidemiology, biostatistics. Different areas in the world will focus on community health versus public health, but essentially they are the same. You know, there are some nuances that are different based on how you're defining your communities as well, but overall they are the same. Great question.
All right, there's one question in the chat. Why is COVID-19 affecting Black people more?
That's a great question. And we're still trying to understand why. You know, like I said, we are in the phase of collecting data and understanding, but some of the hypotheses that we have is people of color have certain social determinants of health that impact their overall health status. So for example, people of color may not necessarily have the access to health care that other people, other individuals or other communities have. And because they don't necessarily have the access to health care, that makes them more susceptible. Or perhaps they live in food deserts. And food deserts are areas where you are unable to get nutritional food. And so we all know that nutrition in a healthy diet impacts our overall health. So there are many social determinants of health that impact people of color more and other ethnicities more. And so that's one of the reasons that we're seeing the greater impact in people of color, ethnic minorities, et cetera. And that's why we really in public health need to focus on health equity, that everybody has equitable services in terms of health. And that's a key component in public health.
Another question in the chat is, some studies/data show that if you mix the vaccines, for example, one shot of the Oxford vaccine with the Russian vaccine, that the results are much better. This study may be very preliminary, but would you consider mixing the vaccines?
So I have not read that study, and it's difficult for me to say one vaccine, mixing of vaccinations, so without reading the study, I don't know the implications of that. However, what I have read and understood based on what's out there is that if you take the first dose, so the COVID vaccination is 2 doses. So if you take the first dose of the vaccination from one supplier, you should be taking the second dose from the same supplier.
Okay, another question in the chat is, do you think some government public health policies will significantly change due to COVID-19?
Yeah, that's a great question. And absolutely yes. Policy implementation and evaluation of policy is a huge part of public health. And I think what COVID-19 has taught us is the importance of having policies in place and the importance of being able to evaluate policies in place. So definitely, I think COVID-19 will have a great impact on public health policy.
Going off of the vaccine talk, there have been like many news of how there's a new strain that comes in, or like new COVID strains are coming in. So how effective would the vaccine be against the new strains, and would there be new vaccines in the later future?
Yeah, that's a good question, and I think the jury is still out in terms of that. We really, first and foremost, the strain that is out there is the one that the COVID vaccination is focused on. A lot of times in vaccinations as well, and again, my area of focus is not virology or vaccinations, but a lot of times with vaccinations, if you have the basic strain covered, it may and it could potentially cover other strains as well. But again, that's not my area of expertise. But I would say let's focus right now on the current strain that's out there and get vaccinated. And then, as the data comes in based on the new strain, we'll see what occurs and what policies are put into place.
All right, another question in the chat is, could you please explain the connection between COVID and myocarditis?
Sure. So one of the connections that we see, myocarditis is essentially inflammation of the heart, inflammation of the heart walls and the muscles, right? And so there are a couple of theories related to that. Number one, COVID-19 being a respiratory disease may then affect how hard the heart has to work, and could cause inflammation there. Also, sometimes the virus itself may attack on a cellular and molecular level, may cause inflammation there as well. And so that's what's really occurring when we think about myocarditis.
If anyone has any more questions, please feel free to unmute yourself.
My question, am I audible, sir?
Yes, go ahead.
Sir, I'm asking question related like the passage of time, there was some type of diseases like polio and Apollo, some type of disease, sir. So the passage of time, sir, there was a lot of improvement and vaccinations was become, sir. So due to that COVID-19, could that disease become endangered or not, sir? Can these diseases back into danger or affecting by these or not, sir?
Yeah, I mean, that's a great question. One of the ways that we stop the spread of disease is by quarantine. The measures that we have taken place, 6 feet social or physically being distant, wearing masks, these are all based on the data that we've collected and the understanding of how the disease itself is spread, right? We know that COVID-19 is spread by droplets, and the reason we're 6 feet apart is that's the distance that droplets can be carried, right? So definitely quarantine it's an important measure of flattening the curve and the spread of a disease from occurring. Is that the only way the disease is going to be stopped? Probably not. That is one measure. So think about that public health slide of all the entities and organizations coming together. It's the same way when we think about a disease itself. There are many ways to flatten the curve of a disease. Isolation, quarantine is one. Vaccination is another one. Basic hand hygiene is another one, right? So using hand sanitizer and wiping things off, things of that nature, that's very important as well. So all of these measures together collectively help us to kind of stem a disease from occurring. And then definitely, yes, vaccination as well. You mentioned polio. Polio is pretty non-existent in the world. There's only 3 or 4 countries where we have polio now. And that's because of the vaccinations that have occurred. The same thing is with other diseases, measles, mumps, rubella, etc. Smallpox is a good example. Smallpox used to be pretty prevalent in the world, we were able through vaccination and public health efforts to stop that from occurring.
Sir, my last question. Sir, what is the main reason behind that COVID-19 generating new types, sir, in every country, sir, like UK, sir? Now it's become a new part of COVID-19, sir. What's the main reason behind it, sir?
The main reason behind quarantine or the new strain? So, viruses are living, are alive, and so they mutate. They are genetic material and they mutate. And so essentially what is occurring is new strains will occur from time to time. Sometimes those strains are so similar in nature that the effects of vaccination could cover them. So for example, a flu vaccination. When we get a flu shot, the flu vaccination has certain strains within it, it will cover those strains. Now there may be other strains that are different, and the flu vaccination may not necessarily cover those strains. But in terms of the quarantine measures in other places, I think those are also very important. What we're seeing in other countries, those measures are trying to stop people from going out and spreading the disease. One of the things that we've learned from the passage of time with COVID-19 was that the asymptomatic transmission of COVID-19 was more serious than we thought. So in the beginning, we only thought that individuals who had COVID-19 were transmitting it. People who were symptomatic were transmitting it. But later on, we figured out that individuals who are asymptomatic, which means they're carrying COVID-19, but they may not necessarily be showing the signs and symptoms of it, those individuals are also able to transmit the disease. And we suspect and surmise that a lot of the transmission that has occurred may actually have occurred from individuals who were asymptomatic. So we've heard in the last 3 to 4 months of super spreader episodes where people were gathered, a large group or a large amount of people were gathered together. Within that group, there were individuals who were asymptomatic, but they had COVID-19, and they were able to then spread the disease to other individuals, and those individuals got sick, and many of them ended up showing the signs and the symptoms, and many of them ended up going to the hospital.
Thank you, sir. Thank you.
Another question in the chat is, my parents have both been vaccinated 3 days ago with the Oxford vaccine. Will the first jab protect them straight away?
So you do need to have both dosages of the vaccination. So that's very important. Yeah.
I'm sorry.
Yeah, that's very important to have both dosages. So when you do get your vaccination, please make sure that you do follow up with the prescribed time schedule to get the second dosage.
What is the difference between equality and equity, and what is the difference between efficacy and effectiveness with reference to the vaccine?
Yeah, so that's a good question. So equality means that every individual has an equal chance of something. Equity essentially is that you're meeting the individual. You're meeting the individual where they need to be met, right? So, for example, there's a classic graphic that you may see on if you were to Google equity, where there are individuals who are standing. There are individuals who are standing next to a fence, and all of those individuals are. Some of those individuals are taller. Some of those individuals are shorter. But they're all standing on like a stool, right? And because they're all standing on one stool or one bench, they all have the equal opportunity to stand on that bench, but still, because of their difference in heights, they're not really able to see over the fence, right? Equity would be that each individual has a stool that allows them to see over the fence and allows them to see see exactly what everybody else is seeing. When we think of efficacy, efficacy is looking at how effective that vaccination is. Is it 50% effective? Is it 95% effective? Is it 99% effective? Right? We want vaccinations. We want treatments to be effective in nature. And there are different types of epidemiological researches that we do. For example, one major type that we utilize is comparative effectiveness trials, where we're taking two methods of treatment and we're comparing the effectiveness of one versus the other. Is one better than the other? Does one have better outcomes than the other one?
Before COVID-19, there have been many highly contagious diseases, but COVID-19 has affected negatively, especially by its fear. Before this disease itself touches, fear drains our activities, cognitive abilities, and even the ability to fight it. Are there any certain strategies to eradicate its fear first?
Yeah, that's a great question. Half the battle of public policy isn't just having the policy, it's implementing that policy. And part of implementing that policy is educating the population, educating the public, is making sure that disinformation is not out there, and is making sure that that fear is not rampant in a society. And that burden falls upon several entities. It falls upon elected officials, government officials, to make sure that they have the right policies in place, to make sure that they are enacting education. That burden falls on epidemiologists as well, to ensure that right treatment guidelines and evidence-based guidelines in medicine is out there, so that they're collecting the proper data, that they are doing proper studies, that once the study is completed, that they are disseminating the information in different avenues, that they are interpreting the data, and they are explaining the data in a way that is easily understandable to the general population. So yes, absolutely. Making sure that fear is not rampant is very important. When we think about that in the context of COVID-19, I can think of two instances where that's important. Number one, making sure that people aren't panicking about the spread of the disease, but at the same time understanding the severity and the clinical prevalence of the disease. And the same thing will go for the vaccination, making sure that there is not fear related to the vaccination. And a key component of public health research and public health policy is also trust. Making sure that we as public health individuals are ensuring that the general population, that the public trusts us. And why is that important? Because if there's a lack of trust, then individuals aren't necessarily going to prescribe to the necessary measures to prevent disease. And then you're just going to be in a situation where disease is rampant in a society. And so alleviating that fear is very important. So that's a great question.
Okay, I think we've gone over time, so we're going to wrap it up here. The mission of STEM Matters is to inspire students to excel in the areas of science, technology, engineering, and environment matters by nurturing their critical and analytical thinking skills. We coach and mentor middle school and high schoolers to prepare them for national and international STEM competitions. You can find more information about us at www.stemmatters.org. I want to thank Dr. Yosef for an amazing talk and everyone in the comments for their wonderful questions. I will be posting a link in the chat, which I ask everyone to fill out. It's a feedback for the STEM Matters organization. So I'll give you guys all a minute to open up the link and fill it out.
Great, thank you, Ms. Shakil, and thank you everybody for attending. I hope you all benefited, and please, as we move through this pandemic, please be safe.
Thank you, Dr. Khan, for an inspiring and very well articulated thought. Thank you.
Thank you, everybody. Goodbye.